If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song you're listening to right now. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Good afternoon, everyone, and happy American Heart Month. My name is Adrian Smith. I'm an anchor and reporter at News Channel 9 in Syracuse, New York, and I'll be serving as your MC today. And I'm so honored and privileged to do so because we're talking about a very important topic that affects so many people. So thank you so much for taking time out of your day to come and join us today. Now, thank you for joining us for the Check It community conversation, How to Manage Blood Pressure, presented by Baxter and the Kidney Drugs Foundation. Now, for those who did join us a little bit early, you may have caught a very important hands-only CPR video. When seconds matter most, CPR can be the difference in whether your family and your friends survive. But not everyone knows how to perform CPR, and that's why the American Heart Association is challenging every household and every family to have at least one person who knows hands-only CPR. Now, the 90 seconds hands-on CPR instructional video, you can share it. There's going to be a link in the chat box. We really want to emphasize you to use that chat box today. So even better, watch it with your family and your friends so you can all learn hands-on CPR together. And even better than that, we're going to play it again at the end of today's session. So be sure to stick around. Today's session is the first in a series of monthly webinars that will be offered throughout the 2023 Check It Challenge. The Check It Challenge is an evidence-based wellness and blood pressure management program that focuses on improving your health by making those simple changes to prevent and manage high blood pressure over the next 4 months. Organizations and individuals are encouraged to sign up and learn more at www.heart.org/checkitny. Now, the Check It Challenge is proudly sponsored by Matthews Auto, Broadview Federal Credit Union, Baxter, the Kidney Drugs Foundation, and media sponsor, CNY Latino. You're going to hear from some amazing speakers today, but these events are entitled Conversations. So before we get started, I mentioned it a little bit earlier, the chat box is going to be our very happy friend today. And we'd like everyone to introduce themselves in that chat box below. Add your name or your company or where you're joining us from. We want you to get used to using that chat box because this is also where we want you to place your questions today. We'll get through as many questions during our Q&A at the end. Now, just a reminder that this is a public event, so please avoid disclosing any personal medical information when using that chat feature. So great to see. I see a lot of messages coming on in. Well, we are recording the session today as well, and it's going to be available on the Check It Challenge website, the American Heart Association New York State Facebook event page, and the American Heart Association's Eastern States YouTube page. You can access all of those materials on the event website, www.heart.org/checkitny. Now, if you are using social media throughout this conversation, please use the handles you see up on your screen at AHA New York and hashtag check it. Now, I'm so excited and pleased to introduce our first speaker today, Dr. Rachel Maria Brown-Talaska. Dr. Brown-Talaska earned a bachelor's degree in History of Science, History of Medicine from Yale University. After working as a researcher in the field of molecular biology, she earned her medical doctorate from Tufts University School of Medicine, and then went on to complete her residency in internal medicine at Northwestern University McGraw Medical Center in Chicago, Illinois. Following her residency, she completed fellowship in cardiovascular disease at New York Presbyterian Cornell Medical Center and was appointed chief fellow during her final year of fellowship. Dr. Brown-Talaska joined the cardiology faculty at Northwell Health Lenox Hill Hospital as director of the Cardiac Intensive Care Unit, director of the Consultative Cardiology, and has then transitioned to director of Inpatient Cardiac Services. She is an associate professor of cardiology at the Zucker School of Medicine at Hofstra Northwell, teaching EKG reading, cardiac physical diagnosis, and health inequities courses. Dr. Brown-Talaska serves on the board of the American Heart Association STEM Committee as an executive leader, is an ambassador for the American Heart Association, and is the chair of the New York American College of Cardiology, Diversity, Equity, and Inclusion Task Force. Dr. Brown-Talaska, a big warm welcome to you, and thank you so much for joining us today. This year, the Check It Challenge is focusing on blood pressure through the lens of life's essential 8. Now, the first question that I have for you, Dr. Brown-Talaska, first off, can you start us with telling us a little bit about what life's essential 8 is, and then where does blood pressure fit into that construct?
Thanks, Adrian, and thank you for having me. I love education. My mother's a teacher, so it's sort of in my DNA to educate and give back to the community. Life's Essential 8, it started actually as a Simple 7, Life Simple 7, over 20 years ago, I believe in 2010. It's the American Heart Association's original formal construct for cardiovascular health. It serves as a means of measuring and monitoring the health of populations and individuals, and it is a target for making positive change, changing the trajectory of your health over time in a positive way. So there's substantial new evidence. Research has shown over the past decade or about dozen years that there's new definitions and metrics for quantifying cardiovascular health, and we've incorporated and updated our Life 7s into Life's Essential 8s. And we will delve into this, but it includes maintaining a healthy diet. I particularly prescribe to the Mediterranean diet. And if you have any questions in the chat box about what that entails, I can certainly get into that later. Physical activity, how much physical activity is recommended by the American Heart Association. We can also, if there's time, talk about that later. Nicotine exposure, or reducing or eliminating nicotine exposure, I should say, if you're a smoker, quitting smoking, not picking up vaping or quitting vaping. Sleep health is essential. It is part of the Essential 8, maintaining good, healthy sleep hygiene, maintaining a healthy body weight, and BMI is one of the metrics for that. Blood cholesterol, maintaining healthy levels of blood cholesterol, low bad and high good cholesterol levels, blood sugar maintenance, a healthy level, and an A1C if you are a diabetic, maintaining that goal of less than 7%, and maintaining a healthy blood pressure, which we will focus on today. Blood pressure is the key target of today's seminar. So What is blood pressure? Why is it important? What are the numbers you need to know? We'll get into all of that, but blood pressure is important because you really don't feel it. You don't feel blood pressure until it can potentially cause you a problem. So until there's a heart attack, until there's a stroke, until you're on dialysis, until you have heart failure, you don't really feel the slow creep of blood pressure. You don't feel that number going from 110 to 120 to 140 to 180 to 210. It can be very insidious hypertension, also known as high blood pressure. So we want to make sure we're proactive in maintaining healthy blood pressure by measuring our blood pressure and knowing that particular number.
And that's something that I wanted to ask you, Dr. Brown-Talaska, is you're an expert, and based on your introduction that I read, I think everyone can agree that you are definitely an expert in the medical field. But I wanted to take it back to the basics a little bit. So why is blood pressure so important? You mentioned it a little bit, but can you dive a little bit deeper?
Yes, so blood pressure is one of the risk factors for cardiovascular disease, and cardiovascular disease has a bevy of diseases in its umbrella, but hypertension or high blood pressure is a significant modifiable risk factor. It is a risk factor you can control and you can improve, right? If you have it, you can reduce your risk by improving your blood pressure numbers. If you don't have high blood pressure, you can improve your outcomes by not developing high blood pressure. In terms of staving off or preventing, as long as you possibly can, things such as stroke, heart attack, heart failure, kidney failure. And the reason I say modifiable is because we can't control our age. That's a factor that all of us have to face, despite the face creams and the serums and the cocktails that we put on our skin and the vitamins we ingest. We all will age. I am currently aging. Family history and DNA is another one of those things, heritable conditions. You can't modify that, at least yet. So the modifiable risk factor, right, are things we have in our power. And high blood pressure, there are many things that can contribute to high blood pressure that we also can modify, not just the number, but contributors to that number, such as obesity or being overweight. Alcohol intake is another one. Sodium intake is another factor that we have in the power of our hands to control. I mentioned smoking and vaping, toxic substances. These drive up blood pressure. They change the structure of your blood vessels over time and contribute to development of high blood pressure, which then is a modifiable risk factor for outcomes such as heart failure, heart attack, stroke, and dialysis. So there's many things we can do to reduce our risk, not just for the development of high blood pressure, but for the bad sequelae that comes after that.
How do those risk factors, both modifiable and non-modifiable, how do those intersect with life's essential eight?
So life's essential eight, I say from a global, comprehensive standpoint, if you adhere or ascribe to life's essential eight, you will have in that catchment, in that umbrella, the modifiable risk factors. And if you ascribe to life's essential eight, then you're taking on things like maintaining a healthy diet, which in turn would reduce your sodium intake. So if you adhere to a diet high in beans, legumes, fresh fruits, vegetables, and lean proteins, low salt, low refined carbohydrates, that's white flour, white sugar, right? That will also contribute to your ingestion of things that are high in sodium, processed foods, fried or fatty foods, packaged foods. These are high in sodium. And if you ascribe to a heart-healthy diet, you will by default reduce your sodium intake. Activity levels, that's in life's essential eight. If you ascribe to life essential eight of maintaining a healthy activity level, 150 minutes of moderate activity, right? You walk, you do light jogging, you double tennis, or 75 minutes of vigorous activity, you're running, you're doing singles tennis per week, that reduces your blood pressure. not smoking, maintaining healthy sleeping. If you have sleep apnea, for example, if you have sleep apnea, this is one of those conditions. If you treat it, you will positively affect your blood pressure. Sleep apnea is one of those sleep disorders that negatively affect your blood pressure. And if you get that under control, maintain good sleep, healthy hygiene, and treat that sleep apnea either with CPAP or other means, then you will affect your blood pressure in a positive way. Weight management, reducing the weight for your frame. We define as BMI, body mass index. How much weight are you carrying for your frame? Kilograms per your meter squared, your height. If you maintain a healthy weight for your frame, then you will also reduce your blood pressure. There are studies that show reduction in particular amount of pound or kilograms lowers your blood pressure by a certain number of millimeters of mercury. Maintaining your blood sugar, blood cholesterol, and blood pressure numbers within a healthy range are also part of life's essential aids. So if you maintain, adhere to that sort of lifestyle of the essential aids, you see under that umbrella, you're capturing all of these modifiable risk factors that affect blood pressure and blood pressure outcome.
All really good tips there. Thanks so much, Dr. Brown-Talaska. But I want to talk about something that's really important, a topic that needs a little bit more discussion surrounding it. Can you address the disproportional rates of hypertension in communities of color, specifically Black and Brown communities, and then other communities such as Indigenous folks?
So we have in the Western world, in North America, we have an innumerable number of studies now that have shown the effects of social determinants of health on heart outcomes in our Black, Indigenous, and Native American populations. So, for example, our Black American, African American population are 40% more likely to have hypertension. Over half of Black women, not old women, 20 years or older, are living with high blood pressure. Non-white Hispanics are among the demographic with the highest hypertension-related death rates. We have our African American female population, women, more likely to develop preeclampsia, and that's a hypertension-related disease or disorder of pregnancy. We have our Asian Pacific Islander population being at highest risk of developing heart complications from preeclampsia. We also have disproportionate rates of obesity, which then is a risk factor, a modifiable risk factor for hypertension, as we've talked about previously. And then when we talk about the sequelae of hypertension, things such as stroke, Black women and Asian Pacific Islander women have some of the highest rates of stroke, and Asian Pacific Islander women have the highest rate of pregnancy-related morbidity due to stroke. And that's secondary to the relationship to preeclampsia, which again, as I said, is a blood pressure-related pregnancy condition. So when we look at these demographics and we see the disparities, then you go back and say, well, we see the disparities. Well, why does that disparity exist? And research has shown, as I alluded to, there's a significant component of social determinants of health. Your neighborhood, your built environment, your access to healthy food and clean air, water, and economic stability, and chronic social stress on the system, meaning your cardiovascular and physiologic system. And these have served to create disparities or perpetuate disparities in these populations. One more thing in terms of history, we have to recognize that this is not something that is just occurring now or happened because of issues that are existing now. This is a historical perpetuation. So things that were present and experienced by great-grandparents and their parents is what is currently being felt and manifested in the current generation. So this is generational, disproportionate heart disease statistic due to social determinants of health in part.
Let's talk now about uncontrolled hypertension. What can lead to it, and then what are the risks?
So leading to uncontrolled hypertension, there's some things that you can control, say if you have stenosis or tightening of the arteries of your kidney system. That's called renal artery stenosis. That can lead to uncontrolled hypertension. If you have adrenal gland or hormonal triggers of blood pressure spikes, that can lead to uncontrolled hypertension. But let's just say, you have essential high blood pressure and it's increasing over time and you don't know because you're not measuring, you don't feel it, and you come in with shortness of breath and you're diagnosed with heart failure, right? That is your first presentation of uncontrolled high blood pressure, but unfortunately that's now led to end organ dysfunction or end organ damage in the presentation of heart failure. So uncontrolled hypertension can lead to these vital organs suffering silently for years and decades, and then manifesting themselves often for the first time with an exacerbation or an adverse outcome, such as a stroke. So blood pressure, you may not feel it creeping up on you over time until you present with arm weakness or leg weakness, slurred speech, a droopy eye, an inability to speak, and you're diagnosed with a stroke and your blood pressure is 180 over 120 or 220 over 110. I'm just giving numbers that I've seen just in the past week for some of my patients here in the hospital. So something that folks may not appreciate is it can be a silent killer. Not only a silent killer, it can be a silent way of debilitating the body. So silent debilitation and silent killer is what I associate blood pressure with. One of the other things that often doesn't get mentioned is the eye. And I don't like to forget about the eye because you don't realize how much you miss your sight until you don't have it. I'm a glasses wearing person, and if I were to be blind tomorrow, that would significantly impair my quality of life. But high blood pressure and uncontrolled high blood pressure can lead to blindness by damaging the arteries and the blood vessels in the eye, as well as the nerves. So it's very important, and I'll go back to this over and over, to be proactive, preventative in our approach in maintaining a habit of knowing your numbers, checking your numbers. I love that video about checking your numbers, and that song's going to stick in my head, and I'm going to sing that like a ditty for the rest of the day. But right, that's why it's catchy. But we should be doing this. Ideally, every morning after urination, place both feet on the ground in a seated position in a chair. Resting state, maybe 3 to 5 minutes. Put your arm in the cuff, press go, check that blood pressure, write it down. You may see your primary care doctor once a year. You may see your heart specialist every month, every 3 months. We check your blood pressure that one time. But if you come to us and you have 30 days of blood pressure reading, that's invaluable. And we can make essential changes to medication, starting medication, decreasing medication, changing doses, or adjusting other regimens, checking sleep, adjusting alternative means of fixing blood pressure, right? If you have sleep apnea, getting you hooked up with a pulmonologist. If you need weight management, getting you hooked up with a nutritionist. Those numbers are essential for us to know. So we don't want ever to see folks come in with adverse events from an uncontrolled hypertensive episode. We want to prevent that. And the way to stay on top of that is by checking that blood pressure every day.
And it's really simple and easy, and it's very quick from what you're explaining, Dr. Brown Talaska.
Takes 5 minutes.
Yeah, what's the best way to check your own blood pressure? And then maybe when should a person maybe speak with their doctor if necessary?
So I know I went through it pretty quick, but step by step. You wake up, go to the restroom, empty the bladder, right? There's a little bit of anxiety. There's a little bit of neurohormonal reactivity when you've got a full bladder and you've got to go, that can drive up your blood pressure. So empty the bladder, then get to a seated position, chair at the kitchen table, chair in your room, both feet on the ground, resting state, not eating breakfast, not talking, resting state for about 3 to 5 minutes. Place your arm in the cuff. I prefer that my patients use an arm cuff, not a wrist cuff, because sometimes the wrist cuff can give erroneous blood pressure. Press go, take that number down, then take your medications, eat your breakfast, go about your day, do your activities, exercise, whatever you like, and keep that blood pressure log going day after day.
Quick, we have about 30 seconds left, Dr. Brown-Talaska. What's one quick thing that you would recommend to all the participants here today to work towards blood pressure control?
Take back control of your heart health. How can you do that? You can do that by knowing your numbers and by adhering to Life's Essential 8. If you adhere to Life's Essential 8, knowing your numbers is within that umbrella. And within that umbrella, you can attack every aspect in a comprehensive way, from weight to exercise to nutrition, and tackle those blood pressure numbers and get you to goal.
Dr. Brown-Talaska, thank you so much. Your insight, your knowledge have just been absolutely outstanding and so helpful for each and every one of us here on the webinar today. Thanks so much. And if you have any questions for Dr. Brown-Talaska, make sure you put them in that chat box below for our Q&A session a little bit later. But now we want to move on to our next guest, Dr. Natalie Powers. Natalie began working as a pharmacy clerk at Kinney Drugs in Clayton, New York when she was just 16 years old. From 2011 to 2014, she worked as a pharmacy intern at Clayton while attending Albany College of Pharmacy and Health Sciences. Upon earning her Doctor of Pharmacy in 2014, Natalie joined Kinney full-time as a pharmacist, covering various stores as needed before becoming staff pharmacist in Alexandria Bay, New York. Natalie was promoted to supervising pharmacist in April of 2015, a position she held until her promotion to medication therapy management pharmacist in September of 2021. In May of 2022, she was again promoted to supervisor of medication therapy management and clinical operations, the position which she holds today. Natalie and her husband Adam live in Clayton, New York with their 2 sons, 4-year-old Grady and 2-year-old Graham. They enjoy boating and camping on the St. Lawrence River and being active in their community. Natalie, welcome. It's great to have you. It's great to see you. Also, big thank you to Kinney Drugs Foundation for their continued support of the Check It Challenge. Dr. Brown-Talaska just gave us a great overview, as you heard, of Life's Essential 8, and also understanding what our blood pressure numbers mean and that we should be checking them every single day. Now, a pharmacist can certainly play a critical role in managing and controlling blood pressure as well. So, Natalie, what role does the pharmacy have in controlling our blood pressure?
Thank you so much for having me here today, and thank you for that introduction, Adrian. So as a pharmacist, we are generally the most accessible healthcare provider. So in a retail pharmacy, we're generally open, first thing in the morning, and we're open all night long, and you don't need to pay a copay or make an appointment to get medical advice from us. So we're generally that person that's there in the community, and patients can come to us with questions about their health or their medications. We're right there, they can see us. In addition to that, we also have access to check your blood pressure at the pharmacy. And if you feel like your numbers aren't good, we're right there to help you and provide advice with where to go from there. So we can also help solve problems associated with your blood pressure or your blood pressure medications, and just help provide strategies to help improve your adherence to medications as well.
Here's an alarming statistic. It's estimated that 3 out of 4 Americans do not take their medication as directed. So what are some of those barriers that people face day in and day out, and then how can they be mitigated?
Yes, we can't say enough that taking medications, no matter what the medication is for, taking that as prescribed is so important. especially blood pressure medications to help lower your blood pressure. Some common barriers that people face are drug interactions. So they might think, oh, I think my blood pressure medication is interacting with another medication, maybe affording the medications that are prescribed. And some patients might just not take their medications because they feel good. And they're thinking, I don't need that medicine, I feel good. So like Dr. Brown-Talaska said, a lot of times blood pressure doesn't always show symptoms. So the patient might take it for a little bit and think, I think I'm okay. But what we can do as pharmacists is we can talk to patients about cost savings options. We can talk to them about their side effects and maybe change the schedule or to have them take it with food or without food. And we can just kind of give them overall education on the importance of taking their medication and checking their blood pressure, even if they feel well. We also offer automatic refill programs at most pharmacies. This is very helpful because we can ensure that we're filling that medication on time, that we have it in stock. And, you know, if you don't have any refills, we'll frequently reach out to your doctor on your behalf to get prescription refills. That way you don't go without, you know, we have no excuses on why there would be a day that you'd have to go without your medication.
So if hypertension doesn't really have any of those signs and symptoms, how do we know the medications we're prescribed are even working, Natalie?
Good question. So the best way to know if your blood pressure medication is working is to check that blood pressure regularly. So at home blood pressure monitors are very easy to use, and many insurances or maybe a health savings account will help cover the expense of those. You can ask your pharmacist for recommendations to ensure you're getting a quality monitor. I always walk the patient right to the aisle with our different options because they have come a long ways with blood pressure monitors. I always recommend kind of avoiding those wrists or those finger monitors. They might be a little bit less expensive, but they are usually a little bit less accurate as well. We really prefer those upper arm cuff blood pressure machines. They also have different options. So there might be a really simple one. So if there's somebody that's not great with technology, we might have a really simple monitor that you're just going to put right on that arm and press one button, and it's going to, you know, it's going to tell you your systolic and your diastolic, that top and bottom number, as well as your heart rate. So we might have one of those. There's also some that connect to Wi-Fi for those tech savvy individuals out there. They might put a reading onto your cell phone, onto an app, so you don't have to keep a journal by hand. You'll have those numbers right there. So there's lots of different options, and we are there for you to help make that decision.
So most pharmacies, they have the blood pressure kiosks available in store. Fun fact, when I was a child, I would put my arm in it and try to take my own blood pressure when I was like 10 years old. But what can people do to get the most accurate reading for themselves when they do that?
Of course. Oh, yes. In retail pharmacy, we have little kids over there all the time pressing all those buttons. But absolutely. So most of our pharmacies have those kiosks right in the pharmacy. Sometimes you might have to walk a little ways to get to the pharmacy. We usually have pharmacies at, the very back or the very side of a big building or a grocery store. So when you get to the kiosk, we recommend sitting down for a few minutes, catching your breath a little bit, relaxing, bringing that heart rate back down, not running to the machine and immediately sticking your arm in. We also want to make sure you're sitting there with both feet just sitting on the floor, uncrossed. Avoid talking during your blood pressure reading. Just take a couple of minutes to just relax and put your arm in that cuff, keep those feet on the ground, and take your blood pressure reading that way. The kiosks are also calibrated frequently, and they're very accurate. So some patients are like, I don't think that was right. But generally our machines, those kiosks that you see in a pharmacy, that's calibrated. It's a very accurate, very expensive piece of technology. So trust that machine. And if you get any reading that seems too high, too low, it might tell you you're in stage 1 or stage 2 hypertension. If you get any of those readings, then we're right there. Our pharmacists are right there. So take that moment to say, can I just ask a quick question? A lot of the kiosks also spit out a little receipt that shows what your blood pressure is. So a lot of patients will hold on to those as well. And they're great to bring over to the pharmacist and just say, hey, what do you think about this? So we're there for you. Our kiosks are there for you. To get that accurate reading, we do recommend just relaxing and taking your time and letting the pharmacist know if you do have any questions about your reading.
Good advice there. Now, how often does someone who gets a reading, is concerned about it at the pharmacy kiosk, how often do they speak up and ask you a question or your colleagues a question about, what they should do next with those results?
Yes. So I feel like I always have one eye on that machine. So if I notice that somebody's like a little bit apprehensive or they try to start the cuff again immediately, I try to intervene. I just want everyone to know that that's what we're here for. Like, we're here to help you, and don't feel embarrassed if your blood pressure is too high or too low, or if you can't figure the machine out. Like, that is what we're there for. And every day I've got a handful of patients who will bring it to my attention. And there's sometimes where it'll be extremely high, where I'll have to say, this puts you at very increased risk of stroke or heart attack. We need to do something about this. Who's your primary care provider? Do you have a cardiologist? So that is what we're there for. And I just want to remind everyone that we are happy to be that accessible healthcare professional that can give you that advice anytime.
One question that just came to my mind, I think it's clear that we've said that we should take our blood pressure every single day and make sure that we're monitoring our blood pressure. But what's that age group that people should be doing so? How old do you have to be? How young do you have to be? What's that demographic of people?
Yeah, absolutely. So any age, go to other than children. So 18 or up, go to that blood pressure machine, take it. You never know. It's important to have a good idea of what that baseline blood pressure is. Some patients just have a baseline of a lower blood pressure, and that's okay. So that's really important to know, because if your blood pressure is higher, it might look normal, but that baseline is a lower blood pressure. So that blood pressure for you individually, that might be a little bit elevated. Specifically, elderly patients, we want to look at them. If you're overweight, if you are a smoker, we want to look at those. So feel free. Those kiosks, they're there for public. They're there for everybody. So don't feel like you're too young. If you're in your 20s and you think you're super healthy, hopefully you are, but don't feel bad to sit down at that machine and take your blood pressure once a month, or whenever you go to visit your local pharmacy or your grocery store. That baseline, and just knowing, okay, that looks like a good blood pressure, then that's what we suggest.
Circling back to blood pressure medication, is there anything that patients should do or avoid when taking those?
Yes. So you might need more than one medication for the best results. And finding the right drug, finding the right dose or the right combination, that might take some time. So some blood pressure medications can also make you feel a little tired when you're first starting them. A lot of times as pharmacists, we say, give your body the time to adjust to that medication. Continue, work through that fatigue, continue through it. Your body will adjust quickly. If your body is used to working on a really, really high blood pressure, it's going to make you tired. You're changing your blood pressure. So stick it out unless you're having, really debilitating side effects. Absolutely reach out to us or your provider to discuss those. But generally, we say, stick out those new dose changes. Hopefully you have a monitor at home, or you have access to take your blood pressure at a monitor. We don't want it to go too low drastically or anything like that. But we also, we don't want you to just start it and 2 days later stop it because it was making you tired. It's also important to consult your pharmacist prior to taking any over-the-counter medications. There's certain medications like anti-inflammatories like ibuprofen, Advil, Motrin, naproxen, different nasal decongestants like pseudoephedrine. These may raise your blood pressure or interact with current blood pressure medications. So if you have a cold or anything like that, feel free to come to your pharmacist and say, hey, I have a cough, but I also take high blood pressure medication. What do you suggest? Again, that is what we're there for.
Any other symptoms other than tiredness when people take certain blood pressure medications?
Yeah, so there's a lot of different drug classes for blood pressure medications. And, if you're experiencing any swelling of your ankles, if you're experiencing a dry, hacking chronic cough that just suddenly came on when you started your medication, this could be a side effect that would make us say, okay, let's discuss with the doctor and get you changed to a different drug class. So there's certainly side effects out there that we don't want you to power through. Fatigue is one that we generally say, that's normal. a little bit of fatigue is normal. But if you have extreme dizziness, if you're getting out of bed or out of a chair, and as soon as you stand up, you're very faint feeling, those are definitely things to talk about with your pharmacist or your doctor. We can tell you, that's normal. You're going to want to get up really slowly out of your chair for the first couple of weeks. Fatigue, it's normal, let's power through. But other things like swelling and a chronic cough, they might not go away. So we might have to take that opportunity to change you to a different drug within the blood pressure class.
Circling back to that alarming statistic that I mentioned, 3 out of 4 Americans, they don't regularly take their medication. So what suggestions do you have, Natalie, on helping people to remember to take their medications, encourage them to take their medications, and also juggle multiple medications if that applies to them?
Absolutely. So this is our specialty as pharmacists. Oftentimes I will see somebody coming and they're going to have a big old Ziploc bag full of medicines. And I know immediately they're going to come and say, am I doing this right? Help me with these. So that's what we're there for. So the older you get, generally you may have more medications to juggle, and it can be confusing. So we can help you pick out maybe a pill tray that fits all of your medications, and you might have a morning and a noon and a nighttime dose. We can say to you, you shouldn't take these 2 medications together. Let's separate those. You shouldn't take this medication with your daily vitamin or your thyroid medication. So there's lots of little things out there. So I love it when someone comes and they're really being proactive with their medications, and they're saying, help me figure out, what time of day I can take these. And so we're there for you for that. And we also want you to know that we are there to give you encouragement. So I recently lost one of my favorite patients. He was in his late 90s. He lived an amazing life, but he had lost his wife about 10 years ago. My favorite thing about him, he'd come to the pharmacy every single morning to use our blood pressure kiosk. And his blood pressure was perfect. It always was perfect, but he wanted that encouragement from us. So we'd go to the kiosk and he'd take his time, he'd take his blood pressure, and he'd come over with his little slip of paper to me every day and give it to me. And I always knew it was going to be perfect. So I'd look at it and I'd be like, okay, you're going to live forever. Like you really are. Unfortunately, it didn't happen, but he had a good life, but he wanted that encouragement from us. And I loved it. I loved seeing him. I loved helping him. He knew we were there for him. He knew our kiosks were there for him. And that's what we want all of our patients to know, is that we're accessible. We became pharmacists for a reason. We are facing the community and we're there for our community. So please don't hesitate to come to us if you're trying to juggle multiple medications, if you're confused about your medications, if you just need that little bit of encouragement, that is what we're there for.
I think we should all take after that man. He sounded lovely.
He was amazing. He really was. And I think because he had lost his wife, he was just lonely. So he wanted that extra encouragement. So we're happy to provide it for him.
I love that. Now, once you're on that blood pressure medication, Natalie, I think a lot of people, they might ask, am I ever going to get off of this? So is it possible for people to wean off of that medication someday, eventually?
Great question. So it certainly is possible to get off, maybe one of your medications or all of your medications, but this generally includes making some lifestyle modifications. So Dr. Brown-Talaska kind of commented on some of those lifestyle modifications. So, reducing your weight, exercising 30 minutes a day, reducing your sodium intake, moderating your alcohol intake, and trying to have a diet that's rich in fruits and vegetables and low in fat is going to help as well. We really suggest making some small changes at first to help make a firm commitment to making these changes, because these are lifelong lifestyle changes that you do have to make if you do want to get off any of your medications at all. Or sometimes, we can even cut back on the dosage of some of these medications. It's not you take it or you don't, we can adjust. We can have you take a half a tablet or take it every other day. Just depends on what medication you're on. But a good point here is to not stop taking your blood pressure medication abruptly. If you are to discontinue a blood pressure medication, we generally want to wean you off of this, and this might require some professional guidance. Sudden termination of any of these hypertensive medications can lead to rapid, dangerous blood pressure escalations.
Last question I have for you, Natalie. What are some of those frequent questions that you get as a pharmacist about blood pressure medications? And is there anything specific that you'd like to share with our participants today?
Of course. So when someone is initially prescribed a blood pressure medication for the first time, that's when I generally see the majority of questions. Patients are a little afraid to take a medication that's going to change their blood pressure. So a lot of times I get questions like, what's this medication supposed to do? How does it work? When should I take it? What are the side effects? Should I avoid activities like working out or running when I'm on this medication? Is it going to make me drowsy when I'm driving? Should I avoid milk products or grapefruit juice? What do I do if my blood pressure gets too low? So these are all questions we're happy to help answer. There's tons of different medications and tons of different drug classes. So it really depends on what medication you're specifically starting. And a lot of times we're there for encouragement, just to say, it's okay. You know, so many patients have to have a blood pressure agent. It's normal to have a medication like this. But as I stated earlier, pharmacists are accessible. We're accessible 7 days a week, usually morning to evening. So do not hesitate to ask us any of your questions. Being informed is only going to help you understand the importance of remaining adherent and helping to make the biggest difference in your life.
Thank you so much, Natalie. Great insight, great information. And just a reminder for all of our participants and our audience to put those questions that you might have for either Natalie or Dr. Brown-Talaska in that chat box. I saw a few popping up as we were doing our session here. But right now, I do want to ask Dr. Brown-Talaska to join us back on video now for our Q&A session. Okay, so we will have our first question read right now.
There was a bit of discussion in the chat box about this, but to make sure everyone has the question and the answer. How accurate is the measurement when using a wristwatch, like a smartwatch, to monitor your blood pressure?
I'll direct that to Natalie, if you'd like to answer that question.
Absolutely. So we do, as a pharmacist, recommend the upper arm cuff as the most accurate reading. There's nothing wrong with a wrist monitor or an Apple Watch or anything like that, but it just might not give you the absolute most accurate blood pressure reading.
Dr. Brown-Talaska, would you like to add anything to that?
I would agree. So I know sometimes you are at the mercy of what's available to you at your local pharmacy. I believe American Heart Association has links to where you can get verified blood pressure reading monitors or blood pressure cuffs. So we'll provide you with that resource. But the blood vessels in your wrist, from a technical point of view, they're a bit narrower, they're smaller and more superficial, meaning closer to the surface of your body, of your skin, and can often give higher readings than is accurate for your blood pressure. So I prefer to have the cuff that sits right here by the bicep or the upper arm area that gives a much more accurate reading. So wrist monitors, watches, wrist cuffs, I tend to want folks to avoid unless that's your only option, but knowing that those readings may be a bit higher than you naturally are.
Great, thank you both. We'll move on to our next question.
Should children take their blood pressure, and are numbers different for them?
I might defer to Natalie. I'm a full disclosure adult cardiologist, so I'm certified to treat adults.
We'll go to Natalie then.
I would recommend a pediatrician if you have any concerns. I mean, when you have children, you're generally bringing them to a well check appointment annually, and I think they would certainly take care of your child. The children's readings are going to be different, though, to answer the question. Their goals and the objectives for a child's blood pressure is going to be different from an adult, and we don't have cuffs readily available for you to take your blood pressure on a child. Generally, that is going to be something that we would refer to a pediatrician or a pediatric cardiologist for.
All right, next question.
Why do medical providers always ask you questions while they are taking your blood pressure?
Because Western medicine is set up in a way that sabotages the patient experience. But that's just that's a personal opinion. But honestly, why also do we check your blood pressure right after we bring you in from the waiting room? Why do we check your blood pressure when you've just gotten off the bus? or ran in from the train, or we're sitting in traffic and stressed about being late for your appointment. These are all reasons why we need to take that resting period with both feet on the ground and check your blood pressure in a resting state, because we're only measuring, your sympathetic system that's in overdrive when you're being rushed into the room. And when we're talking to you, that is going to raise your blood pressure, it's going to raise your heart rate, and will artificially inflate those numbers. So we should not be talking to you. We should not be stimulating you during your blood pressure checks. And we should make sure that you do have time to relax in the chair before we check your blood pressure. So as a partner in this with your healthcare provider, you can say, I'd rather, chill out for a few minutes. Do you mind if we check my blood pressure towards the end of the visit? And that's a way for you to partner with your healthcare provider in resetting that standard. We don't have to do things in a particular order just because, the vitals get done at the beginning of the visit and they have to. No, that's for throughput purposes, right? That's logistical. But from a practical and meaningful standpoint, in partnership with your healthcare provider, just a little nudge. Say, listen, I feel a little out of breath. I was rushing from the train, or, I'd rather not talk while I'm checking my blood pressure. Do you mind if we wait a couple of minutes? No one will be offended.
Natalie, anything to add?
I was just going to say that. Thank you, Adrian. I would also add that is really the importance of keeping a journal at home. So if you have, they call it white coat syndrome, where your anxiety goes up a little bit when you're at the doctor's office, it's really, really, really good to have, maybe that notebook that states the date and the time and your blood pressure readings for the last month or so. That way, if your blood pressure is alarmingly high at that appointment, we're not saying, okay, you need medication. You might say, I am nervous and my blood pressure is never this high. But like Dr. Brown-Talaska said, you might only be going to the doctor once a year or every 6 months. So it's best to have that journal there. That way we can see what your blood pressures are normally running before, we just take it that one time at that one appointment.
Okay, next question.
I've heard you shouldn't eat flax seeds and chia seeds while on blood pressure medication. Is that true?
Natalie?
So a lot of those supplements are okay. You do want to check with a pharmacist before you initiate any new supplement. There's so many different supplements out there, from flax seeds to fish oils and different things like that. So the most important thing is to double check with your pharmacist and say, is it okay to take this? I don't see any problem. There's no interaction with flax seeds or chia seeds with any of your blood pressure medications in particular.
Dr. Brown-Talaska, anything to add?
I would just underscore the point about if you are taking supplements, herbals, any sort of naturopathic treatment for a condition or preventive measure, you definitely disclose that to your healthcare provider and your pharmacist, because that will help us get a more holistic view of what's going into your system, whether there would be an interaction or not. We want to know all of those non-FDA controlled substances.
Great. Next question.
I have 2 blood pressure machines. Where can you have them calibrated? They give different readings.
So some physician offices, some of our cardiology offices here do calibration. I know pharmacy, some larger pharmacy chains do. Natalie may know of some in local areas, but check with your healthcare provider, because most of our offices, you can bring in your cuff to the office for calibration. So that may be a service provided to you.
I would agree with that, Dr. Brown-Talaska. I also would recommend anytime you're purchasing a monitor. So say you come to the pharmacy and you're purchasing an Omron machine. On that box, there's going to be like a little section with a website, a phone number, your ID number off of your machine. So those are good resources as well, because if you do have any hesitations at all, if your blood pressure machine is giving you any problems, you can refer to that website or that phone number, and then they will ask you, directly. Sometimes they can ask you directly off of your device, the ID number, and they can log right in and calibrate it from afar as well.
Okay, our next question.
Our last chat box question today, if I'm checking my blood pressure at home, at what point should I call my doctor?
Great question. Dr. Brown-Talaska, we'll start with you.
So I say if you have blood pressure that's too low or prohibitively high. So too low, it depends on what your condition is, but I treat a lot of heart failure patients, and that threshold is often lower than the normal population. But I say if it's certainly less than 90, or if it's low or lower than your usual, and you're feeling symptoms like headedness, dizziness, double vision, when you stand up from a seated position, you feel a little dizzy or woozy, we call that orthostasis, definitely call it in. If you have a blood pressure, our usual threshold is above the 180 mark on the top or above 100 on the bottom, certainly call that in, because if we can give you a point of care, what we call often pill in the pocket, recommendation for you to take doses of additional medication in the home to acutely or swiftly bring that blood pressure back down to acceptable range, we will give you advice over the telephone.
Natalie, anything to add?
My only thing to add would be if you're taking your blood pressure, at one of our kiosks, let that pharmacist know immediately. We can also direct you on to where to go. There's so many times when I will say, this is very, very high. Like, do you have anybody you can call and they can take you, to the emergency room if we need to do that. So using those kiosks, sometimes if you don't feel well, you don't feel good, something's going on, and you don't have a kiosk at home, a meter at home to check your blood pressure with, go to the pharmacy, have somebody take you to the pharmacy so you can check that blood pressure and talk to your pharmacist before you make a decision on to go somewhere else as well.
Great. Well, thank you both so much for answering all of those questions. And thank you for participating and asking those really great questions. Now, before we part ways, I'd like to ask each Dr. Brown-Talaska and Natalie as well to leave us with a call to action, maybe a closing thought, or the biggest takeaway that maybe you guys took away from today's conversation.
My takeaway is, don't be a statistic, take the power into your own hands, quite literally, and stay on top of daily blood pressure readings. If you do have a blood pressure condition, that is an absolute #1 rule. You've got to be checking that blood pressure every day and keep that log you have on hand to show to your healthcare provider. There are 80%, right? 80% modifiable ways that we can reduce our risk, 20% out of our control. But 80% of cardiovascular disease is preventable. So you've got quite a bit of power. So don't be a statistic.
And Natalie.
I would say, do not hesitate to include your pharmacist in your health journey as well. So we're accessible, we're there for you. We're here to encourage you, support you, answer any questions you might have, and care for you. So don't forget that we're right there if you need anything.
Great. Well, thank you both so much again. Shout out to our amazing speakers today. And of course, to all of the sponsors that you see up on your screen for making the Check It Challenge even possible. And again, thank you to today's presenting sponsors, Baxter and the Kidney Drugs Foundation. And last but not least, thank you all so much in the audience for joining us today. And again, for those great questions. Now, your registration from this event gives you access to all future webinars in this series. The next Check It Community Conversation, How to Eat Better and Manage Health, will be on Wednesday, March 22nd at noon. So check your calendars, mark your calendars. We hope to see you there. And keep checking your blood pressure and let us know how you're doing by tagging the American Heart Association at AHA New York on Facebook, Instagram, and Twitter. And be sure to use that hashtag Check It. We're going to close out today with a special American Heart Month message from Buffalo Bill safety Damar Hamlin, challenging everyone to be the beat and learn the 2 steps to help save a life.
What's up, everybody? It's D-Ham. Once again, I want to thank everybody for the love and support over these past few weeks. As you know, CPR saved my life earlier this year on the field, and CPR could easily save your life or someone you love. That's why I'm proud to announce that I'm partnering with the American Heart Association and kicking off Damar Hamlin's 3 for Heart CPR Challenge. And of course, this one's got 3 steps. Step 1, go to heart.org/3 to watch a short video to learn hands-only CPR. Step 2, donate to the AHA to fund CPR awareness and education. And step 3, challenge 3 friends to do the same. To kick things off, I'm challenging the GOATs. LeBron James, Tom Brady, and Michelle Obama, you've all been challenged. And one more thing, make sure you share your videos on all socials and tag me and have your hearts up.
If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song you're listening to right now. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.